Tonight, the White House is looking to cut funding for a big LGBTQ plus mental health resource.
As part of the proposed budget, they're looking to cut specific services at the National 988 crisis line. Celine Era shares how those cuts could affect people in Central Georgia.
Tequila Plus has been a therapist for about 10 years and says she's personally met people who work for 988.
It's like calling 911. You know, people take their job so seriously because they know, some people know what it's like to be in that seat of wanting to possibly end their lives.
When people under 25 call 988 right now, they can be connected with LGBTQ plus specialist counselors.
I think that is tremendous work. I think that is the heart of the matter. I think that is humanity at its finest.
But under the new federal budget proposal, that funding for the LGBTQ plus services would shift to the general 988. That would end the specialized services for young LGBTQ plus people in crisis. Over at Theater Macon, Richard Frazier says it would be harmful to the LGBTQ plus community that he's a part of.
There's so many individuals who grow up their entire lives hearing that who they are is wrong and being and living their most authentic and true selves is against a religion or political beliefs.
He says for some people, especially in rural areas, talking to someone on the phone might be their only safe space to express who they are.
Providing as many resources as we can to ensure that people understand that they are loved, even if they may not be feeling that from a portion of their life.
And Plus says taking away funding,
you're also taking away chances to save people's lives. You're actually dismissing lives. What if a person can't get to the hospital to express how they feel?
Reporting in Macon, Celine Era, 13 WMAZ News.
According to the American Psychiatric Association, LGBTQ plus folks are more than twice as likely to have a mental health disorder than anybody else. And while funding for the service could be cut, the budget for 988 and other behavioral health services is proposed to stay the same as it did under the previous administration, about $520 million.